Welcome to the Highlex Health and Performance Podcast. I'm your host, Dr. Chelsea Smith, here to guide you through all things physical therapy and whole body health. At Highlex, we believe the Almighty God designed us to move, heal, and thrive. Join me as we dive into pain relief, post-surgical rehab, life lessons, and key insights I share with my patients every day. Let's move better, heal stronger, and live fully. All right, welcome back. So today, I want to talk about what are the discs that you see in some of my pictures and videos? What are these stickers? You might have seen them around town, who really knows? But it is called Amino Neuro Frequency. And I really just want to give a general overview of what it is, introduce you to it, and just spark a little bit of maybe thought about it. And if it's something that you would like to try, obviously I'm happy to utilize that with you. But really, I just have so many people that are like, what in the world are those stickers? So wanted to dive in. So Amino Neuro Frequency. Let me just back us way up and let's give a general kind of definition of what this really means. So the human body, every human biochemical function has its own frequency. Now, some of this may seem really far out to you guys, so if it seems way too complicated, don't worry about it. Just know that we are water, carbon, and electricity. I think we all can generally accept that as truth, right? So the way that things actually happen in our body is a signal from our brain, travels through our nervous system, and it instructs the body on what it needs to be doing. When there is inflammation or when the neurons are not firing the right way, we end up with, generally speaking, reduced function and then eventually pain. So pain is not always the first sign of an issue, actually. It's one of the last signs of an issue. And I really enjoy this framework of thinking because it just makes so much sense to me as someone who believes that my body was made by a creator with its goal, and in our perfect state before the fall, it was to be able to heal itself. I mean, people lived significantly longer than they do now when you're looking at things in Old Testament, and I won't get into all of that, but just anybody that knows me knows that I do love the Lord, and I do believe the Bible, and so it just sparks all these thoughts of like, what in the world? And then, there's these scriptures of God is love, and he spoke things into existence, and what does that mean if I'm trying to visualize that? I think there's a level that we just won't understand stuff, obviously, but when we start talking frequencies, it just makes a lot of sense to me. So anyways, going into it, as a therapist trained in pain and inflammation level of amino neuro frequency, there's several different levels that you can get trained in, and I am at the pain and inflammation level. We are examining the body following the nerve paths. We also assess lymphatic system. We do a lot of deep diving into, stressors, traumas, history of anything, emotional trauma or physical trauma, and we're trying to find the root cause of the problem. So the hierarchy that this goes down is emotions, then lymphatics, then visceral organ systems, then musculoskeletal, and just pain as an output is what we assess last. With the ANF disc treatment, they are thin circular discs. They are actually carbonized metal, and they are applied directly to the skin. They're real pliable. It doesn't feel like metal when it's on you. And they transmit neurofrequencies through the neurons in the body. So the nervous system picks up these frequencies and it starts a self-healing and self-regulating process, because what it's doing is it's trying to improve the signaling directly at a cellular and a neural level without the use of chemicals or equipment, no drugs, anything like that. It is just aiding your body in reducing inflammation and improving its function overall. So let's talk about the phases of treatment with ANF. So phase 1, when the person has a high level of inflammation and pain, the goal is to decrease inflammation and start healing. A lot of times people will feel a pretty significant change in their pain level pretty quickly with these devices if we apply them correctly, and there's caveats of and, if they are open-minded about this treatment protocol, and if their body is not focusing on too many other things. So they kind of have a catchphrase of, when nothing else works, try ANF. And so I have found that my patients that feel a quicker response, they tend to be people that have already been trying to address stuff. They maybe have already been working on their eating, their hydration levels, stuff that it's already helping the body work on reducing inflammation. Not to say that this is not helpful for anybody not like that, but as far as just who I see has a quicker perception of change, it tends to be that category of people. If they don't feel a reduction in pain, sometimes they will feel detox symptoms. So I have a patient who she can tell as soon as I put these on, she can kind of just, I don't even know exactly how to describe it. She can just feel different. And she is a fairly healthy person. Now, I've also put these on people who have a lot of inflammation, have a lot of things going on, and they will feel almost a flu-like sensation, some body aches, maybe a little lightheadedness, maybe some dizziness. And that is pretty common. If it's too much, we can always tailor back that approach and start with lower frequencies. But that is phase 1, is really try to reduce inflammation and start the healing process. Phase 2 is when inflammation and pain have reduced, and now the goals are minimize inflammation and continue healing. And then phase 3 is tissue repair and healing. So the goal is much more focusing on actual healing and remodeling and helping that neuron and that neural oscillation heal. So it's going to pick up the frequencies of the discs that are charged to discs or frequencies of the human body. They're not adding electricity. They're not doing anything different than what the body typically would do. But it's going to pick that up and it's going to start healing itself, which is amazing. And then phase 4 is maintenance. So you may hear me flipping through some papers because I wanted to quote some exact things. When I talk about open-mindedness, this is something that I talk to my patients about in general. The mind is so incredibly powerful. If you are convinced nothing's going to work for you, if you are convinced that everything is awful and that your pain is going to be forever, it's a lot harder for your physical body to move out of a painful state. It's harder for it to move out of a fight or flight state and just accept that healing can occur. Thoughts are incredibly powerful, and they are frequencies. Thoughts are frequencies. One of those philosophical, what are thoughts? Like, how does my brain work? So we won't get into the nitty-gritty of that, but a negative thought can actually take the frequency of your body down. It's negative 12 hertz. And a positive thought is 10 hertz. So if you are following with me in the fact of the negative one was larger, negative 12, and the positive one is 10, if you are in a total negative cycle, this therapy is probably not for you necessarily. There's a lot of people that I don't, not because I think they're negative people, but it's just not necessarily appropriate yet. They're maybe not ready to try something like this because I'm not sure that they wouldn't just overpower some of the changes that the frequency discs can make with their mindset. And again, this kind of sounds far out, not necessarily super far out if you've talked to me, met me, but these are just fascinating things. So when we're looking at stuff like a healthy body, let me just give you some perspective here. A healthy body operates between 62 to 68 hertz. Generally, it can be higher, lower, but generally the accepted frequency of a healthy body is 62 to 68. If we are looking at when things go awry, okay, so when we start thinking about cancers, generally when the body is below 42 hertz is what they've found, we see much more prevalence of cancers, illnesses in general, autoimmune diseases, things like that. And then below 25 hertz is when the body starts to die. So again, think back to when do they declare somebody dead? It is when they have no more electrical signaling coming out of their brain, which means their heart doesn't work anymore. But even if they have something pumping their heart and something pumping their lungs, they're technically deemed alive as long as they still have brain function, which is electricity and frequency. So when we are, the other one I wanted to mention is candida, like gut symptoms, is down in the 55 hertz. So big emphasis on making sure that the gut-brain axis is addressed. There are specific frequencies for every organ system. Things like the gut are 55 hertz, the heart is 7 to 8 hertz or 140 megahertz when we are looking at things in a state of damage versus optimized. So again, I'm not going to go into too many of these numbers because that's not really the point that I wanted to tell you guys. I just wanted you to get this overall understanding that everything operates on frequency. Our body creates stuff. So let's talk a little bit about antioxidants. So I think most people have seen, an avocado or a banana that you leave out and it turns brown. That is oxidative change, oxidative stress. When we have too much oxidative stress in the body, because we don't have a high enough production of antioxidants, that is when things become impaired. Impaired glands and organ function, our lymphatic system becomes impaired. It affects our energy level. It can cause fatigue, autoimmune, anything in this just general, something is not right category. So some common ones that people are familiar with is melatonin. That's a very strong antioxidant that the body makes. Glutathione, a lot of people are becoming more familiar with. It's also created by the body. And carnosine. So the liver produces glutathione, and in pretty much every single state of illness, the production of glutathione has gone down, which is just fascinating to me. And you can supplement it, yes. So you can go and you can get oral glutathione, you can do an IV of glutathione, you can do an injection of glutathione. But what better way to approach this than encouraging your body to be able to produce it on its own? Because if you can only absorb what it is able to absorb, if that makes sense. So if you can't produce it effectively, you're not going to absorb it effectively. So when it comes down to, do I supplement? Do I, what is the goal here? I am totally sold on the fact that if we can just make the body be able to go back to its own ability to create it, let's do that. Absolutely, let's do that. So that's a general overview. There are protocols for a lot of different things. And then, of course, there's a specific assessment we can do, a full history that gets a much more specific. But there are illness protocols, there are gut protocols, there's lymphatic protocols. There's general orthopedic protocols for shoulder pain, neck pain, whatever the case is. There's general protocols that we can use as kind of a guideline, but then really it takes a full assessment and a full history to get a much more specific approach. Something else I thought was very interesting that I was learning in this course that I've heard and I've known, but it really just didn't fully start to click, but emotional trauma and even physical traumas, but mainly emotion, it can take up to 10 to 15 years for that to express itself through pain, through something in the musculoskeletal system. So energy is not created nor destroyed, right? So if we have something that shifts us in a huge emotional capacity, it's eventually going to show up somewhere. So I just thought that was very, very helpful because I always dig into people's past and I want to know what past traumas have you experienced? What is your emotional state right now? But this has really encouraged me to dig even deeper and farther back. And if they have something that just doesn't make sense. And again, as a physical therapist, I treat a lot of things and some things are just straight up orthopedic. Hey, I got injured. Boom. This happened. I twisted. My knee popped. Boom, boom, boom. We go through a typical rehab process. Everything is great. It rehabs fine. The pain levels decrease. They go back to typical function. These are cases when we're talking about really needing to dig further of, okay, I've tried all the things. It hasn't worked. Hey, did something happen at all that you can think of 10 to 15 years ago that might be prevalent here? So that is just really, really, really cool. So again, how does it work? So by combining the ANF discs, which is a frequency emitting wearable device, these are grade 1 medical devices as well also. Each disc is applied directly on the skin and it is activated by body heat. So they transmit a unique range of frequencies through the neurons in the body. The nervous system picks up the frequencies, starting a self-healing and self-regulating process by improving the nervous system signaling directly at the cellular level. The effect can be immediate, whether that is pain relief or potentially detox symptoms. Sometimes it takes a little bit more tweaking of the protocol to get it a little bit more accurate, but it really has been cool. So we'll go with a few personal testimonies of this because I've been using it for several years now, and I would just like to make it something that people are more aware of and just be able to have it as a resource, honestly. So I personally, the first time I used it was more in an illness situation. So this was 2021. I had not been ill in a very long time. Probably 8 years without being ill, and controversial topic, but this is when a lot of people were starting to get vaccinated. They were also rolling out 5G. Both of those are controversial topics because the 5G rollout was just at the same time as illnesses. And if you are into this frequency world and you understand how the body works, you'll find it very, very interesting that every single time there's been a mass breakout of illness, an epidemic, a huge event where there's been a lot of sickness and a lot of death, it is pretty much always timed up with a change in frequency around the world. Whether that was addition of electricity, whether that was the addition of cell phone towers, whether that was the addition of increasing the frequencies of the cell phone towers. And mind you, these 5G towers are up in the 50 gigahertz. So reminder that I just said the happy human body is 62 to 68 hertz, and we are now being blasted with 50 gigahertz, if not more, and all the time. And they're adding towers all over the place. So all that to say, there was all these things going on, and I went to an event around a ton of people, and by the time I got home, my tonsils were like white, and your tonsils are a lymph node. And so I'm like, all right, body, what are we working on here? Like, I didn't feel bad. Everything was totally fine. But I like to keep tabs on my lymphatic system and just see, what the status of my body is. And my lymph nodes were getting inflamed around my neck, under my jaw, and my tonsils were white. I'm like, oh my gosh, what is going on? So I put on a protocol with white blood cell over my thymus gland, which is what produces your white blood cells. I put vitamin C and vitamin D over my tonsils, and I did a lymphatic protocol, and I kid you not, within 12 hours, they were completely back to normal, and my lymph nodes were normal. And I never did spark any illness right then. Go body, go lymphatic system, doing what it's supposed to be doing, picking things up, chewing it up, and getting rid of it. So that was just really neat. And then in COVID, I actually mailed out so many of these protocols to people. There is a CARE, ANF CARE program that I will also be, I'm an affiliate for. So for people that are not local and you would like to be able to access this, but they have virus protection, they have 5G protection, they have general illnesses, they've got allergies, they've got headaches, they've got menstrual cramps. I mean, anything you can think of, you can address with frequency medicine. But all that to say, when people were sick, I went on, like Dr. Chelsea mode. I'm not a medical doctor by any means, but I am a let's heal your body in whatever way your body can heal itself person. So I had vitamin protocols, I was sending out ANF protocols, and people were getting better so much faster than the people around them that were not using these things, which is pretty cool. What's another good one is generally, okay, so I had a patient who, she's got a lot of stuff going on. She's had a big history of gut issues. She's had thrush before. She's had a cervical fusion. She has a lot of nerve pain or paresthesia, just weird sensations around the face area. And we were getting progress, and then we weren't. And then we were getting progress, and then we weren't. And so I was like, let's just zoom out. Let's look at ANF. And we started with lymphatic protocols. And, is it coincidence? Is it not? I lean towards it's not, but we got such a forward shift in symptoms. A lot of the facial paresthesias were reduced. We were just able to improve symptoms so much across the board in so many different ways. And I credit that to zooming out even further. And it's like, what is driving this? Why is this not clearing up? Because inherently, like I've said before, the body should, in the absence of inflammation out of control, which is basically the definition of any disease, it should be able to heal itself. And so if we're not seeing an appropriate healing response, we've got to ask why. Why is this not doing what it should be doing? And so if it's something with this musculoskeletal or neuromuscular and it's not getting better, you've got to look bigger. You've got to look lymphatic system. You've got to look at organ system, and you've got to address trauma. So, okay, that is just a general overview. I'm really excited about it. I would love to be able to get trained in all the different levels. It takes some time. So anything that's out of my wheelhouse, I have a mentor named Santi, and he's amazing. And I will always connect people over there to him. He's down in Florida, and he pretty much doesn't even use manual therapy very much anymore. He uses ANF for almost everything. It's amazing. He obviously embraces exercise and hydration and movement and all these things. But as far as using a hands-on skill of I'm going to alter your pain level with this hands-on skill, he's able to get awesome results with just utilizing ANF. So the stickers, funny story about this. This was pretty funny because I am the only Tennessee person certified right now, I believe. That could have changed, but I believe I am still the only Tennessee person. For sure, the only Chattanooga person. I had a patient and she was in a Pilates class and she looks over and she sees these stickers on someone and she knows what stickers are because she's had them used on her. And she was like, hey, did you see Chelsea recently? And the lady was like, yes, obviously my other patient. She's like, yes, how did you know that? And she was like, well, I see your stickers and the only person I know that uses those stickers is Chelsea. So I just thought it was really funny. My husband finds them all around the house. If I've been wearing them for any reason, they eventually fall off, like in the bed or in the shower. You wear them for 72 hours, by the way. I didn't say that in the beginning. 72 hours, you can wear them longer. Children can wear them longer because their bodies don't absorb all that frequency quite as fast, so they don't have as much inflammation as us. Theirs will last longer. You can use them on even down to newborns. You just don't put them on the skin because we don't put adhesives and things like that on a baby's skin. You can put them on the onesie. It's really cool. It's something where I feel it embraces just the way that God made our bodies to operate. And we live in an inflammatory world right now. Everything is coming at us, whether that's EMFs, with 5G, with just psychological warfare, spiritual warfare, toxins everywhere. It's in our food, it's in the air, you just can't get away from it. And being able to just optimize the body, how it's supposed to be optimized, embrace sunshine, like embracing grounding, all of that just jives with me. And so I've been very happy to be able to bring it into my practice with ANF. So hopefully this sparked a little interest. This one was a little longer of an episode. I know I said it was going to be brief, and then here I go talking a whole lot. But if you have anything weird going on, reach out. Let's talk. Let's see if we can figure out a protocol that may work for you. I am going to start doing certain days of the week where I'm just at the office for a chunk of hours, hopefully. That's not set in stone yet, so I'm not going to say any days or times on that. Right now, I'm just going to go on my regular scheduling. But yeah, let me know, and I will get you guys more information in detail if you want. And then I'll tag the ANF care below, and I'll get I say below. Give me a minute if you're watching this or listening to this. I mean, pretty quickly after it's up. But I will try to link all that affiliate link stuff too. That way, if you guys want the ANF care for general illnesses, headaches, sinuses, all of that, you can access it. Okay? Thank you for tuning in to the Highlex Health and Performance Podcast. I hope you enjoyed this episode and learned something new to help you move, heal, and thrive. If you'd like to dive deeper into any of these topics, feel free to reach out to me directly at chelsea@highflexhealth.com. Visit our website at www.highflexhealth.com or connect with us on social media. Keep learning, keep moving, and keep healing. And I look forward to having you back for the next episode.